I'm here with Ryan Squire, who is the Social Media Program Director for Ohio State University Medical Center, and he's going to be on a panel tomorrow at the Healthcare Internet Conference speaking about some of the opportunities and challenges he's had developing the social media program, along with some representatives from other hospitals who are doing the same thing. So Ryan, thanks for joining me today.
You're welcome.
And could you tell us just a little bit about yourself and what your role is at OSU?
So my background, I came from the news business. I was a journalist and worked as a videographer. So it's different to be on the other side of the camera. But I started there and had some success telling stories. And storytelling is something that I'm passionate about. Worked my way into social media and television and realized the opportunity that social media gives us to connect with customers, to put customers at the forefront of the experience with the organization, whether it be a television news station or a healthcare organization. And so when I joined Ohio State, I was really interested in the brand that we have, personalizing healthcare, and how we can use social media tools and technologies to do just that, to personalize a patient's experience with healthcare. And so over the last 12 to 18 months, that's what I've been working on, is setting up the systems and getting our organization ready to be able to do that.
Great. So at your panel, you will be talking about some of the challenges that face setting up the social media program. I know we've heard clients talk about everything from just getting buy-in from senior executives to simply getting access to the networks at their hospital.
Right.
What sort of challenges did you face as you were developing your program?
So the challenges we had in January 2009, before they had even hired me, we started dealing with the access issue, and one of the challenges we had was productivity in our organization, and the perception that productivity was falling because employees were using social media, Facebook specifically. So they started to block access to social media. 2 months later, when they hired a social media director, they expected us to start using social media. And so the first thing that I looked at was being able to have access, because I don't think that we can use social media as an organization unless we give the power to our employees to use it. Before we can communicate with our patients, and really use social technologies with our patients, I think our employees have to be empowered to do so. So the next step after we decided that we wanted to give access to the employees, which is so essential, was to create a policy. Policy is the way that healthcare organizations especially exist. They let their employees know what's expected of them by putting it in policy, and I think following that and following the expectations the employees have around a policy is important. I also think that policy that you can't create culture, and a lot of the time we create policies to try and create a culture, and culture is the byproduct of consistent behavior. And so instead of just creating a policy, it's important that we model and expect certain behaviors from our employees. And so that's been kind of a cornerstone of the way we're working to push social media forward at Ohio State. So through education and through modeling and peer modeling, that's the way that we think we're going to get the most traction.
Can you talk a little bit about the tactics? For example, what networks are you primarily using, or is there a centerpiece to your social media policy or program?
So a centerpiece to the program, I would say that externally we use Facebook probably most effectively. Part of that is because Facebook is just the most widely used social network, but also because we've been able to look at some of the communities that already exist. So for instance, one of them in Columbus is the Stephanie Spielman Fund. And Stephanie Spielman is the wife of NFL football player Chris Spielman, who is a Buckeye standout. And Stephanie battled breast cancer for years, 3 or 4 different times. And so the community rallied around Stephanie and really internalized her fight against breast cancer. And so you look for opportunities like that to help empower a community to rally behind something that already exists at your hospital. And so that's what we did. And that's what we continue to do, is look for those opportunities to just put the tool in place that will bring patients and community members together around something that they find in common.
What advice or recommendations might you give to a hospital who's looking to build a social media program?
So I think the first thing that you need to do is look at access in your organization. Make sure that the people who you want to use these tools, whether you want them to use them explicitly or implicitly, have access. Giving access to your employees is a vote of confidence to say, not only do we trust you to take care of people's lives, but we trust you to communicate about that and to communicate about the incredible work you're doing. And so access is absolutely essential, especially in healthcare. Secondly, then, I'd stop looking at the tools, at the social networks themselves, as the end-all be-all, and I would instead take a step back and look at your strategy, your overall digital strategy, which should roll to your organizational strategy, and take a look at that digital strategy and say, how can we provide better experiences for our patients? Because that's what social technologies do. The philosophy behind social media and social technologies is such that we give our patients tools and the ability to have better relationships with our organization. And so look for those opportunities, and don't think just about your patients. Think about the people who you want to recruit into your organization. Think about the donors and the people who that keep your organization alive. Look at your entire business process and make sure that your business processes match up with the brand that you're trying to create. Marketing departments have always tried to create brands for their hospitals, and those brands are important, and they're the fabric of the hospital. It's what people get to know the hospital. But I think it's really important that you're honest with yourself about the brand that your patients and your customers experience, and making sure that that's the same brand that you're messaging.